What you are about to hear is going to fundamentally change the way you look at every single blood pressure pill sitting in your medicine cabinet. If you are taking Amlodipine, Losartan, or Lisinopril, there is a very real clinical probability that a physical symptom you have been dismissing as age, stress, poor sleep, or just a bad day is actually your biology trying to warn you. Your medication is affecting your internal systems in a way no one fully explained. Patients do not usually suffer severe clinical consequences when these medications are prescribed correctly. They suffer when they do not understand what the chemical compound is actually doing inside their vascular system. They miss the biological clues until a serious medical event occurs. Before we begin this protocol, subscribe to the Medmetrics so you never miss clear, peer-reviewed health data designed to protect your biology. If you have been prescribed Amlodipine, Losartan, or Lisinopril to manipulate your blood pressure, there are 11 clinical truths you must understand right now. Not because your physician is hiding them, but because clinical appointments are rushed and patients leave with a chemical intervention and only half the required data. By the end of this protocol, you will understand which physical side effects are expected, which are dangerous medical emergencies, and why the most important truth has nothing to do with the number on your monitor. Number 11. These three medications are not interchangeable chemical compounds wearing different labels. Amlodipine is a calcium channel blocker. Losartan is an angiotensin receptor blocker, or ARB. Lisinopril is an ACE inhibitor. They all lower blood pressure, but they utilize completely different biological pathways. This means they create completely different patterns of physical side effects. Amlodipine physically relaxes blood vessels in a way that commonly forces fluid into the lower legs. Lisinopril chemically triggers a persistent dry cough. Losartan is often the clinical alternative when the respiratory system rejects lisinopril. If you assume all blood pressure medicine acts identically, you will misinterpret your body's warning signals. You must learn the exact pattern of your specific drug class to prevent a manageable reaction from turning into a medical emergency. Number 10. The biological mechanics of amlodipine swelling. This is one of the most misunderstood side effects in cardiovascular medicine. Patients assume they have eaten too much sodium or that their kidneys are failing. The clinical reality is a microscopic pressure imbalance. Amlodipine forces the small arteries in your legs to relax significantly more than the veins do. Blood flows down into the lower extremities easily, but struggles to flow back up against gravity. Microscopic hydrostatic pressure builds inside the tiny vessels, and blood plasma physically leaks through the cellular walls into the surrounding tissues of the ankles and feet. This is why your socks leave deep indentations by the evening. Ignoring this fluid buildup can lead to severe mobility issues and uncontrolled blood pressure, as patients secretly skip doses to avoid the swelling. Number 9. The delayed lisinopril cough. This chemical compound can cause a dry, persistent, aggravating cough that does not always begin immediately. Sometimes it takes days, sometimes weeks, and sometimes it appears after months of treatment. Patients constantly misdiagnose themselves. They blame dust, seasonal allergies, acid reflux, or dry winter air. The cough is scratchy, unproductive, and relentless, often worsening at night. This occurs because ACE inhibitors alter respiratory chemistry, causing irritating compounds to accumulate directly in the lungs. However, you must instantly differentiate this nuisance from a lethal emergency. If you experience swelling of the lips, tongue, face, or throat, or if breathing becomes restricted, this is a life-threatening condition called angioedema. It requires immediate emergency intervention, not a phone call to the clinic on Monday. Number 8. The hidden potassium trap. If you take Losartan or Lisinopril, your potassium levels become critically important. You do not have to take potassium pills to be in danger. Potassium is heavily concentrated in over-the-counter salt substitutes, heart-healthy seasoning blends, and electrolyte powders. Both Losartan and Lisinopril naturally raise your body's internal potassium levels. Flooding your system with extra dietary potassium actively alters the electrical rhythm of the human heart. This chemical overload manifests as severe muscle cramps, physical weakness, tingling, and dangerous heart palpitations. Patients actively trying to follow low-sodium diets accidentally trigger cardiac emergencies because no one connected the clinical dots regarding potassium interactions. Number 7. The truth about your kidney numbers. Losartan and Lisinopril are often prescribed specifically to protect the kidneys and the heart over time. However, when you first start these medications, blood tests may reveal a small rise in creatinine or a dip in eGFR. Patients see these numbers and panic, assuming the drug is actively destroying their kidneys. The biological reality is different. These medications physically alter the pressure dynamics inside the kidney's microscopic filtering system, the glomerulus. A mild, early shift in the data is often an expected mechanical adjustment, not a sign of cellular damage. This is precisely why mandatory laboratory follow-ups are required. Guessing at kidney function is dangerous. Clinical data interpretation is mandatory. The severe danger of sudden dehydration. If you are taking Losartan or Lisinopril and contract a stomach virus resulting in vomiting, diarrhea, or heavy sweating, your internal fluid volume plummets. The exact same dosage of medication that stabilized your pressure yesterday will hit your depleted vascular system completely differently today. Without adequate fluid volume, the medication drives your blood pressure too low. Your kidneys become acutely stressed. You experience severe dizziness and can easily faint. The medication did not become toxic. The biological environment collapsed. Taking heavy blood pressure medication blindly when your body is severely dehydrated is a massive clinical error. Number 5. The over-the-counter kidney destroyer. Millions of patients combine their daily blood pressure pill with Ibuprofen, naproxen, or other NSAID pain relievers for arthritis or back pain. If you take Lisinopril or Losartan, and especially if a diuretic is included in your protocol, adding daily Ibuprofen creates a perfect biological storm for acute kidney injury. These compounds severely restrict blood flow directly into the renal system. Patients do not consider drugstore pain relievers to be serious medication, but this specific chemical interaction is highly dangerous. Over-the-counter anti-inflammatories are not casual supplements. They require serious clinical review. Number 4. The mechanics of postural hypotension. Dizziness, lightheadedness, and the woozy sensation when standing up too fast are often normalized by patients. With all 3 of these medications, your cardiovascular system requires time to adapt to the newly lowered internal pressure. When you move from lying down to standing, gravity violently pulls the blood downward. If the medication is acting too aggressively, the blood vessels cannot constrict fast enough to push oxygen back to the brain. In the senior demographic, a 3-second dizzy spell easily results in a shattered hip or a traumatic brain injury. Persistent, severe dizziness is not something to silently endure. It is a clinical indicator that your dosage requires immediate recalibration. Number 3. The isolated data trap. Blood pressure is not a static biological number. It is highly volatile. It fluctuates aggressively based on physical pain, psychological stress, posture, caffeine intake, and sleep quality. Measuring your blood pressure immediately after a stressful event and concluding your medication has failed is a fundamental analytical error. Medications like Amlodipine, Losartan, and Lisinopril must be judged by long-term clinical trends, not isolated moments of panic. Frantic, repeated testing creates extreme anxiety, which artificially spikes the pressure further. Good medicine, combined with bad data interpretation, leads to erratic, dangerous patient decisions. Number 2. The pharmacokinetic timing rules. These compounds operate effectively only when taken with absolute consistency. They rely on maintaining a stable chemical half-life in your bloodstream. If you miss a dose, the clinical protocol is almost never to double up later. Taking 2 pills simultaneously forces a massive, sudden drop in vascular pressure, causing extreme dizziness and potential fainting. Blood pressure medications are not immediate rescue pills for random, momentary spikes. They are long-term biological stabilizers. They work through steady, disciplined administration. If your schedule is compromised, follow clinical guidance, not emotional guesswork. Number 1. The ultimate clinical truth. The optimal blood pressure medication is not the one that generates the perfect data point for 3 weeks. It is the specific compound you can tolerate safely and consistently without destroying your quality of life. Amlodipine works flawlessly for some, but causes crippling fluid retention for others. Lisinopril protects the kidneys, but can ruin sleep architecture with a chronic cough. Side effects are not a sign of personal weakness. They are raw biological data. Swelling is data. Coughing is data. Extreme fatigue is data. A responsible patient tracks these specific physical patterns and reports them to their physician before the symptoms escalate into irreversible tissue damage or uncontrolled hypertension. The moment you understand the exact biological mechanisms of your medication, the fear dissolves. You stop imagining that every minor symptom is a catastrophe, and you stop ignoring the highly visible clinical red flags. Knowledge is your ultimate biological defense. Share this data with anyone managing their cardiovascular health. Subscribe to the Medmetrics and take command of your biology today.